trauma-informed care is, and then dive into how that can be applied in different specialty settings. Today, we'll discuss the background of what trauma-informed care is, and then dive into how that can be applied in different specialty settings in separate modules. Here is a list of our objectives.
Know the old saying, don't judge a book by its cover? Well, the same is true when you assess a patient. Hi, I'm Dr. Cruz. Early in my career, I noticed a pattern with some of my patients. They often had multiple health issues, were uneasy during office visits, and frequently visited the emergency department. But worst of all, they never got better despite multiple visits. Then I realized something. From an early age, many of my patients were exposed to trauma and adverse childhood experiences, or ACEs. This includes emotional, sexual, or physical abuse, violence, neglect, discrimination, poverty, and other adverse events. ACEs are more common in the US than you'd think. In fact, 60% of US adults have one ACE, 25% have 3 or more ACEs, and 16% have 4 or more. ACEs occur in all socioeconomic groups, but are more common in low-income and minority populations. For young children, repeated exposure to trauma can impact brain development and literally rewire the brain's response to stress. So as they grow up, many struggle with issues related to emotional regulation, like depression, anxiety, or substance use disorders. Trauma survivors are also more often at risk for chronic diseases, behavioral health problems, and even suicide. Knowing all this, I began to rethink my approach to care. Instead of asking patients, "What's wrong with you?" I ask, "What happened to you?" Recognizing that life experiences are often a root cause of poor health is integral to improving patient care. Trauma-informed care has helped me take these experiences into account, providing greater insight into my patients' needs and how to address them. Here are 5 key ways that healthcare organizations can gradually integrate trauma-informed care into their practices to help patients and staff. First, build awareness and generate buy-in. Involve both staff and patients in adopting a trauma-informed approach. Second, invest in a trauma-informed workforce. Hire staff that embrace trauma-informed care and provide training not only for clinical staff, but also for non-clinical employees like front desk workers or security guards, who are often the face of your organization. Next, create an environment that is safe and welcoming for patients and staff. Engage patients in meaningful ways. Ask how they feel and listen. You can also build trust by involving them in their own treatment planning. Finally, identify and treat trauma. Consider a screening approach that works for your patients and ensure that treatments and referral sources are available. These changes take time, but each step improves our ability to connect with and care for patients. Today, our patients appreciate the changes we've made. Plus, our staff is more in tune with patients, so work is less stressful and more rewarding. Trauma-informed care. It can truly transform the caregiving experience from being treaters to being healers.
Experiences children might face can impact their adult lives, and those experiences are known as adverse childhood events, or ACEs, and they can be categorized into abuse, neglect, and household dysfunction. Those 10 different types of ACEs, a type of trauma, and the relationship between health outcomes have grown to include more foundational aspects of social determinants of health, including social conditions or the local context in the setting the stage for ACEs, like economic and community impact of violence, bullying, poverty, or access to food. It has been shown that there is a strong dose-response correlation between ACEs and risk behaviors and disease conditions, and that they're cumulative. That means the more children might experience ACEs, the higher the ACE score, and the more likely to have the poorer health outcomes. Brain imaging in children and adults who experience childhood trauma shows that developmental trauma is correlated with decreased volume in brain structures and functional abnormalities in the frontal and limbic regions of the brain. Developmental trauma is more dangerous than a simple trauma because complex trauma is typically experienced within the context of interpersonal relationships. Experiencing physical abuse, sexual abuse, neglect, witnessing domestic violence all violate children's understanding of safety and trust for themselves, relationships with others in the world. These children tend to be anxious, reactive, and demonstrate impulsive behaviors to cope, leading to increased risk of physical and mental health problems. Trauma can have many definitions, but the Substance Abuse and Mental Health Services Administration highlights the important caveat of not limiting trauma to just a singular event, but the lasting effects of the perception of that lived experience and how it can range for everyone. SAMHSA has divided trauma into the 3 E's to allow us to have a quick reference to understand that trauma first is the event, being the actual or threat of physical and psychological harm. That can include a wide array of things, from physical, emotional, and sexual abuse to racism, poverty, and other forms of violence. Secondly, experiences shape that further and highlights that one's personal culture, age, and understanding influence how traumatic experience may be for one person compared to another. And finally, the effect or the duration from that event influences long-term overall health, from difficulty with coping or relationships to the inability to regulate behavior. Importantly, our perception about an event is subjective and can change from experience to experience, person to person, or even moment to moment. We have here a traumatic event most of us can now relate to, COVID-19. Starting in January 2020 was the first confirmed case, but the lived experience from isolation, lack of resources, or working in healthcare was different for all of us. This event has shown to have a significant effect on PTSD, depression, and anxiety. Day-to-day well-being relies on the balancing forces in the hypothalamic pituitary adrenal axis. Receiving input from both central and peripheral nervous systems, the HPA axis maintains neuroendocrine homeostasis in all mammals and facilitates appropriate neurobiological responses to any stress or challenge. A well-integrated system uses a limbic system to sense danger and transmit that to the HPA axis for downtrace release of corticotropin-releasing hormone and adrenocorticotropin-releasing hormone, which downstream increases cortisol and catecholamine response, and then quickly returns to baseline. But in chronic stress, it leads to dysregulation of this response, which can lead to inability to cope with stress. Traumatic experiences have been shown to increase the risk of negative health predictors, including substance use and sexual behavior, resulting in an increased risk for disease, but also is associated with chronic diseases like cancer and heart disease. This is tied to the change that stress has on our brains, impacting many factors that are tied to increased morbidity and mortality. We have here again the behaviors and risks to physical and mental health, and at the end of this module, we'll provide a link to an ACE quiz through NPR that can help put things into perspective for how you can identify with this topic personally. It's important to highlight that ACEs don't condemn people to do poorly, and that there isn't an opportunity for resilience through positive experiences, but just to have a conversation about awareness and building the skills to identify and engage with others mindfully. Here in Philadelphia, this public health burden of childhood ACEs was evaluated by over 1,700 socioeconomically and racially diverse residents that showed these staggering statistics. It shows the relevance to our community and patient population and charges us as clinicians to better understand the health impacts. Not only is there a health burden, but the cost burden of trauma linked to ACEs shows that even a 10% reduction in ACE prevalence in Europe and North America could lead to an annual savings of 3 million disability-adjusted life years, or $105 billion. A specific example of the savings can be shown through trauma leading to increased risky behavior, including smoking, and that the smoking-related diseases cost over $300 billion annually. A trauma-informed approach to care acknowledges that healthcare organizations and care teams need to have a complete picture of a patient's life situation, both past and present, in order to provide effective healthcare services with a healing orientation. This model highlights the 4 cyclical steps of realize, recognize, respond, and resist. Realize is the first step, and you have to understand the types of trauma, their risks and outcomes in order to approach patient care differently. This approach should be included in every facet of medicine, not just emergency medicine. Recognize is the next step in order to recognize the signs of trauma. This can be through screening tools. It can also be through signs and symptoms you notice in the office. We can recognize through screening before you even enter the door, and we'll have an example of what that looks like on the next slide. But often, trauma survivors have strong physical reactions in response to their environment, even when most would consider them benign. These are the alterations in their stress response and can lead to hyperarousal. Their bodies learn to associate strong negative emotions with physical reactions. Experiencing with any of the 5 senses, this means that similar physical cues or sensations can trigger these emotional and physical reactions even when they're objectively safe. Nonverbal triggers may be noticeable if trauma-informed, for example, hypervigilance, fidgeting, exaggerated startle response, difficulty sleeping, and trouble with relationships. Signs and symptoms of sexual violence are listed on the right-hand side of your screen and can show just how nonspecific these can look, but if you are trauma-informed, it could be on your differential. Here's an example of the adult ACE screener. Although universally screening for trauma in healthcare setting has benefits and challenges, it allows for recognizing and referring patients to treatment for experiencing negative health outcomes, but requires time and resources. So before implementing universal screening, it's important to consider the benefits, challenges, and resources available. In this module, we'll talk about several other types of screening tools or ways to recognize signs and symptoms, their utility, and how you interpret them. So how can we begin to identify trauma? We screen, but it's important to remember it's an informed process that should initiate a system for addressing the results identified. In other words, if you get a positive screen, you should have a plan in place on what to do next. The next step is responding. That means responding to integrate these topics and how they can be implemented in clinical practice. Utilizing these 6 key principles of responding in a trauma-informed way can look like establishing emotional and physical safety with a private, quiet space and allowing the patient to drive the conversation at their own pace. They can anchor trust, support, collaboration with providing options and information and allowing the patient to choose what makes most sense for them. This respect of autonomy is validating and affirming to ultimately empower. Throughout this process, cultural competence is a principle to consider the context of the situation when making plans and recommendations. One of those 6 key principles is safety, and we can create a comforting environment both through how you socially present yourself as well as the physical environment. So that means keeping a quiet, separate space that's pretty relaxing and to come into the room in a non-charged way. So it's positive language, make sure that the staff at the front desk is also understanding of trauma-informed care because it starts when you enter the building. Next is trustworthiness and transparency. Again, making sure that you are getting informed consent and providing non-judgmental support. Collaboration and mutuality is a very important tool, and you can use motivational interviewing techniques. And a way to remember that is the OARS technique, asking open-ended questions, affirming the patient's strengths, reflecting on what the patient is saying, and summarizing at the end. An engaged patient who is empowered to share their voice in their shared decision-making process is critical for adherence and overall health. But there are even daily changes we can recommend to address a dysregulated stress response. Things like sleep hygiene, diet, and exercise. The trauma-informed care approach addresses core principles including expressing empathy, rolling with resistance, and supporting self-efficacy. This technique is a way to help patients become partners in their own healthcare decisions. Again, culturally responsive is important in order to understand culturally specific traumas and be sensitive to their social context. Last is resist. So it means to intentionally and actively avoid re-traumatization, and re-traumatization can occur through any of the five senses, and triggers can be in many forms: smells, sounds, touch, phrases, and overall feelings of loss of control. Simply asking a patient what their preference is and consistently checking in with them and observing their behavior may also alleviate trigger reactions. Trauma-informed care involves organizational and clinical changes that can improve patient health and wellness and decrease avoidable care with engagement and increase treatment participation and adherence. Although understanding that as providers we may not have as much of a say in organizational implementation of trauma-informed care, we can do our best in our own patient interactions. Many clinicians are hesitant to incorporate patient-centered interviewing into their routine as they worry it will affect their efficiency, and that's especially true in a busy emergency department. It can seem overwhelming to take the time to ask patients small questions like their name they prefer and taking an extra moment to express empathy, but the data suggests that suggesting these tools can result in a more efficient and mutually satisfying patient encounter. Hope you guys got to learn a little bit about trauma-informed care and just highlighted our capstone goals, and thank you for your participation.